There you go. Good boy.
The most common unmet health need across the age spectrum ends up being oral health.
Has he seen a dentist yet, Amanda?
So
Not yet.
where is that education then on the most common unmet health need occurring in the medical system?
You're doing a good job.
Before 10 years ago, no one in the medical community was having a conversation about oral health. It was really this great medical and dental divide.
And it's only more recently that we've begun to listen to each other and really appreciate what is the unique added value that we all bring to the table that really advances the overall health of the patient.
Hi, you ready to get your teeth varnished?
This is very much about a sea change. Historically, primary care and oral health were separate delivery systems, and to get primary care providers to think about incorporating oral health care as a part of their everyday practice is the challenge, but I'm very hopeful because the right people are in the room.
Certainly, the need to provide care now is urgent. We're working with emergency room doctors in terms of
Health professionals, I find, don't readily think about the connection between oral health and overall health. And it is so interesting to see the traction that one can gain when you explain that connection, provide a knowledge base, show them how easily it can be integrated into a program so that they are thinking about the mouth as an essential part of overall health.
We agreed that we were not going to fight, we were not going to try to rip one another up, but find the things where we had common ground.
There are a lot of barriers, you know. There's a lot of barriers to just about any new idea. But that just means that you figure out what they are and you start taking them off. And I think that's what this initiative is about.
If we can just get the word out.
We've made a lot of gains in the last decade, and a lot of it has been due to the committed individuals who saw just that need.
Look at your medical record.
I think the people participating in this initiative have a great opportunity to overcome the past barriers that allow them to work together effectively.
Payment, certification, those sorts.
They've put their weapons down and they're going to move forward and be persistent until they have a solution that makes sense.
You're exactly right.
And my organization, the American Dental Association, is very committed to this.
I thought it was really significant today that the ADA did endorse the Smiles for Life curriculum. And really by doing that, I think was saying, yeah, we really want to work with our colleagues in the medical community.
This is huge. And in endorsing the Smiles for Life curriculum, the American Dental Association has not only indicated that they feel strongly that the messages and the science we're presenting is appropriate, but they're also sending a message of collaboration with the medical community.
Acknowledgement of those differences is important.
We're really meeting the needs of the various professions that are gathered. And this is a preventable disease, and the more trained professionals are to work on prevention, we'll see some better health outcomes.
I think if you really want to affect change in a profession or in society, you have to build a set of relationships. And I think that's one of the key things about the NIIOH. It's bringing together key decision makers, policy makers, and educators, and forming relationships between them. And it's those relationships that we can leverage to make change.
Share at least part of a common database.
I think it's a long time coming and a timely arrival, and it's exciting to be having real partnership with people that can motivate a much larger subset of professions than the pediatric or the family medicine or the physician community alone has been able to do.
We all recognize the value in it, but you're right, there's such a thing as a learning moment.
Our accrediting body is helping our PA programs understand that oral health is the perfect way to build on interprofessional practice. Oral health is the perfect way to introduce public health to students.
So as this initiative moves forward, I think this will grow very quickly beyond a novelty to standard of practice.
So there are issues with regard to dentists feeling comfortable seeing pregnant women, and there are issues with obstetricians and midwives knowing the importance of oral health as part of it.
It's amazing to me how much work has been done. An incredible effort across a variety of sectors, public and private. The foundations have really stepped up. We're past the question of if or should we. It's a question of how. And I think that, 5 years from now, it may take a little while, but 5 years from now, we won't even be asking the same question. It will be part of comprehensive health care.
And wouldn't it be grand if folks could come out of school already knowing how to deliver those services and being able to address it with all of their patients? Not only the young children, but through the lifespan.